Hi, my name is Spencer, colleague on IDNT. Today I will present about my individual assignment for the QRU 3083 rehabilitasi otot dan rangka dalam cedera sukan. I will present about ethical issues in the sport rehabilitation. First, I will to thanks to my lecturer, our lecturer, Dr. Muhammad Azrul Anwar bin Sokafi. Okay, introduction. Ethical issues present challenge for help professional working with athlete or sport team. Healthcare professional including team physician, the physical therapist or the sport therapist. The athletic trainer are faced with the challenge of returning the athlete to competition as quickly as possible but as safely as possible. Conflict of interest due to conflicting obligation of the team physician to the athlete and other member and sport organization including coach and the team owner. The multiple stakeholders involved in sport teams challenge the traditional notion of confidently and autonomy. Next is about we will present about the ethical problem in sport rehabilitation. Many of the ethical issues that care of the athlete often result from unique and dynamic interaction of multiple stakeholders associated with sport franchise. This include the health care professional, team physician, athlete trainer, and physical therapists or the sport rehabilitation or the sport therapists. The athlete themselves and management including coach general manager and in professional sport the team owner. Right. Additional stakeholders include agents, families, the media, and fans. Because these various stakeholders often have different interests and goals, health care professionals are often conflict about the proper course of the treatment for an injured athlete. Conflict of the interest are common in this situation. Subsequently, sebagai pro athletic trainer with experience working with in the working athlete with athlete. Pressure to play early come not only from management but it is from player and the sport rehabilitation also is that's why the sport rehabilitation is very important in the one group or the in sport team is very important for the sport rehabilitation to prepare themselves to treat the player from injured when they when the competition start or um when the player start playing, right? Next is informed consent. Informed consent, confidentiality, and other ethical issues. Because of conflict of interest, the team physician faces unique situation related to ethical principle of autonomy and to confidentiality and informed consent. After explaining the procedure, the risk and benefit, and alternative, the athlete may uh, operation for the meniscus repair ready to sacrifice short-term playing time for longer rehabilitation and better long-term outcome. After explaining the procedure, the risk, benefit, and the alternative, the athlete may uh, opt for the meniscus ready to sacrifice the playing for longer rehabilitation and better long outcome. Yet, when advised of the athlete decision, the coach agent and owner may disagree, hoping for the quicker return. Alright. Ultimately, the royalty the loyalty of the physician must be loyalty of the physician or the sport therapist must be toward the wishes of athlete despite pressure exert of the sport rehabilitation to change the athlete mind, right, or the physician. In such case, the physician must advocate for the most uh, appropriate cosmetical treatment given the evidence. If when given full this disclosure, disclosure and informed consent, the athlete decide for meniscectomy, the sport rehab must weigh the benefit and risk doing the alternate procedure based on his or her best on judgment. As mentioned above, in the final analysis, the sport therapist or the physician have the right refuse the medical treatment that one just to be inappropriate. We must remember that sport rehabilitation should never agree to the medical procedure that is not considered standard and appropriate care. It always the ethical obligation for the health care professional justify their medical decision based on the sound professional judgment. The field of sport medicine is evolving constantly due to innovative research, emerging technology, and financial investment from the commercial enterprise. Certain emerging medical intervention and technologies in the experimental stage all have the later clinical evidence supporting their efficacy in long-term outcome. Not too long ago, thermal capsular shrinking technique developed vocal flowing in the orthopedic and media hype in lieu for a more aggressive but successful surgically tightened stabilization procedure for athletes with recurrent shoulder dislocation. Alright. That is a suggestion for the ethical conduct. Having brought forward the issue ethic in the sport medicine, we turn now to suggestion improve the ethical decision making abilities to help care professional working with a sport team. First, we advocate the sport medicine fellowship program include an ethic component dealing with the conflict of interest issue present by high level of athletic. The training position in ethical reasoning present case that involve ethical content. Current research in expert practice, a core fellowship clearly indicate the expert practitioner use multiple source of reasoning, including technical, narrative, and ethical reasoning as part of patient care. Should be clear. Rule governing relationship between medical practitioner, facility, and athlete team organization. There is evident that in cases where sport rehab or the sport therapist employed directly by the sport team may sport team or where a physician facility pay premium to treat team athlete, a conflict of interest may arise with treatment well-being or the patient athlete be compromised in favor of short-term gain for the sport organization. Remember that code of ethics have limit applied to the ethical decision making to solve ethical dilemma because they do not provide any particular hierarchy of the principle that govern in this situation. A basic framework of ethical decision making should be integrated into the continuing education. Should be certification course in the sport medicine or the sport rehabilitation. Okay, that's all for my presentation. That's all from me. Thank you.